Welcome to today's AIPH Green City Briefing, Urban Green Spaces for Health and Wellbeing. I'm Francesca Boyd and I'm part of the Green City Initiative team here at AIPH. Green cities bring nature and plants into urban environments to transform spaces and lives. As part of the AIPH aim to celebrate the power of plants, we're delighted to share with you that the AIPH Green City Awards are now open. Find out more about how to showcase and celebrate your city's achievements via the QR code now on screen. Now, without further delay, please may I introduce Giselle Sebag, an architect, urban planner, public health specialist, and serving as the executive director of the International Society for Urban Health. She's also the founder of the Vital Cities Collective. With nearly 2 decades of global experience, she leads efforts with global governments, communities, NGOs, philanthropies, and the private sector to design healthier, inclusive, and sustainable cities by addressing the urban determinants of health through cross-sector collaboration. I mean, incredible. I can't think of a more capable person to be emceeing us today. Thank you for joining us. Now, over to you, Giselle.
Thank you so much, and good morning, good afternoon, and good evening to everyone, depending on where in the world you're joining us from. As Francesca said, I'm Giselle Sebag, the Executive Director of the International Society for Urban Health, and I've spent nearly my entire career dedicated to creating healthier neighborhoods, communities, and cities by design. And in terms of the International Society, for the past 23 years, ISUH has been the only global non-governmental organization that's dedicated to our specific mission, which is to work across all the disciplines and sectors to address the urban determinants of health and health equity to attain a healthier future for all people in all communities worldwide. I really want to thank Audrey and all of the organizers for having me, and a special thank you to the International Association for Horticultural Producers for organizing this important and timely panel. I'm delighted to be your MC today for a topic that really couldn't be more relevant or urgent. So why are we all here today? Well, at this point, there's really no doubt access to and exposure to nature in cities is critically important for our health and well-being. As you're going to hear more about from our panelists, the science is at this point unequivocal, whether it's the quality of air that we breathe or our mental health or how long we live, even our social connections and bonds or the strength of our immune systems. Green space has a profound and measurable impact on our health and well-being. We've learned from really at this point decades of research that, for example, children who are growing up in greener neighborhoods, they may have better lung function and have lower risks of asthma. They might have better cognitive learning abilities, and that can last an entire lifetime. And adults that live near green space and have that experience and exposure, we've seen from many, many studies that they may have significantly improved mental health outcomes, may have reduced visits to mental health providers, or even lower use of medications like antidepressants. And we found that even small doses of nature, even just 15 minutes a day, can lower those stress hormones and reduce anxiety and boost immune responses. And of course, I'm sure many of our panelists and many of you all have heard this or agree with this, but I often argue that nature in many, many ways is better than medication or medicine because it actually prevents diseases before they start. And it can lower our blood pressure and just quiet our nervous system, improve our cognition. It can even encourage meeting people together, creating those social connections and encouraging resilience across all age groups. And you're going to hear more about this, I'm sure, today as well, but crucially, exposure to nature is also an equity issue. So not everybody has equal access to safe, accessible, and welcoming green spaces, but of course, the people who stand to benefit the most usually have the least. So today's session is really more about just beautiful landscapes, although it's also important to be attractive and beautiful, but it's really also about environmental health, planetary health, and human health in such a profound way. And I just want to acknowledge that this webinar is part of the AIPH Green City Briefings, and so we're focusing in the panel discussion and in the question and answer after, we're going to be focusing on real world projects and how we really put the science into action. And we're incredibly fortunate to have 2 brilliant speakers with us today. So first, we're going to hear from Dr. Nathalie Röbbel, who leads the urban health work at the World Health Organization. Dr. Röbbel is a great friend of ours at ISUH and has been instrumental in advancing global knowledge in urban health and in developing practical guidance on housing, air pollution, and the broader social determinants of health. Today, she's going to help us understand how green space fits into the global framework for improving urban health and the many health and well-being co-benefits of greening our cities. So with that, let's get started. And please join me in welcoming Dr. Nathalie Röbbel. Over to you.
Thank you. Thank you very much, Giselle, and a warm good morning, good afternoon, and good evening to all the participants. And it's a real pleasure to be attending this webinar. I will be sharing my screen. Just a second, please. I hope it is visible for everybody. So what I would like to do in the next couple of minutes is start a little bit from a broader urban health perspective and then trim down to the importance of nature, green spaces, and its impact on public health. And maybe just to start, but just looking at our cities worldwide and how they do impact the health of the populations. And without wanting to go in too many details on this slide, but just to remind us all that actually cities are really at the heart of public health. And we know that 9 in 10 people today in urban areas do breathe polluted air. Cities are increasingly experiencing high temperatures, so 3 to 5 degrees higher than in the surrounding rural areas. We also definitely know that urbanization is strongly associated with the risk of obesity. And certainly we also know that urbanization is strongly associated with rapid spread of vector-borne diseases. Very often we do think that vector-borne diseases is a typical rural issue, but actually in the current situation with an increased urbanization, with the risk of climate change, we're actually experiencing vector-borne diseases being a true public health priority in urban contexts. So these are just some of the statistics to mention. And the reason why I'm mentioning them is because obviously they're very, very strongly related also to the way that cities are shaped, the way that they are managed, but also certainly the role that green spaces do play within the urban context. And certainly if we look at urbanization, and again, putting this in the context of looking at the relevance of green spaces, of nature on health, we need to see urbanization as related to other societal developments that actually do impact our societies and our health. So this is regards to deforestation, intensive agriculture, but also obviously broader pollution issues and migration. So there is an increased interaction at the human-animal environmental interface, and this actually interface is particularly important at the very urban level. So and the reason also that from a public health perspective, we need to look more concretely into urban planning, into urban policies and their impact on health is because actually urban policies are particularly important to address health inequities within cities. We do know that 350 million children still live in informal settlements, that we are seeing an increased number of internally displaced people that do settle in urban areas. And actually, if we do look at the example of COVID, we are reminded that actually in one and the same city, the mortality due to COVID was very different from one city quarter to another, depending on many social factors. So why am I saying all this is because when we talk about public health, the urban systems are increasingly important. And obviously, we need to make sure that an action on one particular issue will affect many others in a very unpredictable and unintended way. So an action in one sector can have actually a benefit in many other sectors. So when we talk about urban health, we need to see urban health as a cross-cutting and a coordinated approach. So we need to make sure that we do consider urban health not only from a siloed approach, sector by sector, or we need to see only one risk factor. We need to look at all these different items together. And WHO has been, over the last couple of years, been increasingly working on the matter of urban health and on an integrated approach. We have published a number of different policy briefs that really do help practitioners on the ground to be taking this kind of systematic, evidence-based, integrated approach. And certainly we are also aiming at producing a guide very, very soon. And certainly, and this is my last slide before we will deep dive on the role of green spaces, is that if we want to achieve broader urban health outcomes, better urban health outcomes through urban policies, we also need to make sure that we build the capacities of the different stakeholders that are involved in this area of work. So it's about strengthening capacities of different players. There is, pardon me, I'm just stopping because, yes, there was a mic which was on. We need to make sure that actually different stakeholders covering different sectors have actually the capacities in place to work with each other. So now let me move concretely and specifically to green spaces and health. Because actually addressing green spaces and health requires all these capacities, requires actually the urban planners, the landscape architects, the public health officials, community members to work together. And here we see that actually, if we look at public health and we look at the evidence, we have a very, very strong evidence state about the knowledge on the impact of green spaces on biodiversity and on health. And these are just some examples of the work that WHO has been working on with many partners. And we see that there is an increase of scientific evidence about the interventions that actually can help, but also how nature, biodiversity, and health are interconnected. And if you go into the epidemiological evidence and the pathways, we see that there are several different pathways that are to be looked at when we look at the availability of green spaces and the impact on health. It's about the environmental benefits that will have an impact on heat island, for example, or flood mitigation and air quality, and how that in turn will have an impact on health, but also nature benefits as regards to UV exposure, social benefits. Giselle mentioned this in her opening, and also more definitely the mental health benefits, where there is an increased evidence about the enhanced nature connection and then the impact on the health. And so if you look specifically of the main health outcomes where we have the evidence, we know that green spaces have an impact on reduced cardiovascular morbidity. They reduce type 2 diabetes. There's a strong knowledge and evidence about improved pregnancy outcomes, reduced mortality due to cardiovascular, respiratory, and internal causes, but also improved mental health outcomes. And here, just to focus on two examples. During the pandemic, there was a study that has been showing, or actually the symptoms of depression and anxiety were actually reduced with accessible outdoor spaces and also with natural elements in the windows view. So it's not only about using the green spaces, but it's also about seeing the green spaces, being able to be living in an environment, in a visual environment that actually impacts mental health positively. And actually the symptoms of depression and anxiety have been going up with lockdown severity. So the stronger the lockdown, the more confined people were living, the stronger the symptoms of depression and anxiety. And if we then flip it around now, and we want to look at specific actually interventions, I would like to share an example from a work that WHO has been doing in Ghana, Accra, the city of Accra, where it has been implementing a project which was called the Urban Health Initiative, that was looking at urban health interventions for air pollution reduction and climate change mitigation. And within this project, we have been using a tool which is called the Green UR modeling tool. And this tool allows actually to model how, if you increase actually the accessibility to green spaces, what is going to be the impact on health. And this modeling, in this very specific case of Accra, Ghana, has shown that with this very small increase of green spaces, actually you can significantly reduce premature mortality. So a 3% increase of green spaces in Accra would actually result in 77 annual prevented deaths among the adults in the city, or 5% increase will prevent 139 premature deaths. And if we look specifically at the mental health outcomes that I was mentioning before, the scenario was characterized by a greater availability of green spaces would actually lead to 53 cases of depression incidents prevented among the adult population. So it's not only about the evidence that we know about exposure to green spaces and the positive health outcomes, but it's also the fact that we actually can, in a very given specific urban context, we can actually model how changing policies, changing the environment will be beneficial for health. And thus, to go back where I started from, when I was saying that green spaces are actually a fundamental entry point on how to address urban health more broadly. I was making the case that if we want to achieve urban health outcomes more sustainably and in a more integrated way, we need to see how actually all these different dimensions that do affect health in an urban context play with each other. And certainly to do this, you have very different entry points. You could look at a very specific risk factor like air pollution, or the importance, for example, also to looking at specific vulnerable population groups within a city, like the aging populations or young adolescents. But you would also do it by using green spaces as almost like a very specific thematic entry point that will bring together the collaboration of different sectors and that will have multiple benefits. So the notion of co-benefit that is so important is very important in the discussions of green spaces. As we were seeing before, having better and more available and accessible and maintained green spaces will not have only one benefit, but will have actually a multiple benefit, and therefore will be very cost effective even in health economic terms. And maybe to conclude, if nature, was a pill, it would actually be reimbursed by the healthcare insurance. So I think we need to make sure that green spaces are available locally and for all. And this is actually to be understood as a true public health intervention. So as a true, almost, I would say, medical intervention, right, in order to avoid that actually any expenses need to occur for care and health systems. So with this, I would like to end, and I'm handing over back to Giselle and looking forward to the discussions.
Thank you so much, Nathalie. That was so excellent. And thank you really for making so clear the case for nature is the best medicine and the vast health and well-being impacts that it can have, and for taking us to Accra to see what you've already done. Really fantastic, and such a great view, such a strong case for nature. So thank you. Next, we're going to be hearing from Samanta Pereira de Souza, Technical Assistant at the Municipal Health Department of Sao Paulo. Samanta and her team's work was instrumental in Sao Paulo winning the Living Green for Health and Wellbeing Award from AIPH, and she's going to share with us how such an important and leading megacity in the Global South is making environmental health and equity central to city living. So Samanta, I'm going to pass it over to you for your presentation. Thanks so much.
Thank you, Giselle. Thank you, everybody. So good afternoon, everybody. My name is Samanta, and today I'll be presenting the Green and Healthy Environments Program, also known as PABS, on behalf of the program coordinators, Patricia and Monica, that are here with us. I would like to sincerely thank you for this recognition and for the opportunity to share our work with you. So we are in São Paulo, the largest city in the country and one of the largest in the world in terms of population, with almost 12 million people. And here in São Paulo, we have a constant concern about social environment issues. And with this in mind, 20 years ago, the Municipal Department of Green and Environment, the Municipal Health Department, and the Municipal Department of Social Development, with the Department of Education, developed everybody together the Green and Healthy Environments Project, known as PABS. 17 years ago, the Municipal Health Department incorporated PAVs as a program within the Family Health Strategy under the primary care here in São Paulo, with the goal of integrating environmental issues into health promotion actions. This consolidation led to a broader understanding of the health and the environment, highlighting the role of social factors in the health and illness process. The swallow was chosen as the symbol of PAVs because the blue and white swallow is a small swallow species commonly found near houses here in São Paulo, making a comparison to community health workers who maintain a consistent presence in individual households. PAVs also seek to promote new healthy practices grounded in the values of civic responsibility here in the city, in the defense of life and environment, to strengthen intersectoral collaboration by encouraging community empowerment and active participation, and also to contribute to the development of integrated public policies here in the city, with a focus on environmental issues relevant to population health. The main objective of PAVs is incorporating environmental issues into health promotion actions, consolidating a broader concept of health and environment with the emphasis on the social determinants on the health disease process. The PAVs is within the Health Promotion Division with 340 basic health units here in the city, environmental promotion agents who work with more than 90,000 community agents, and 2 municipal coordinators, Monica and Patricio, here with us, 6 regional managers, and 40 local managers, everybody working together in this program. PAVs develops its actions and projects focusing on 6 guiding pillars, which are interconnected by the principle of a culture of peace that underlies all of them. So we have the solid waste management, gardens and health eating, water, air and soil, biodiversity and tree planting. We have the revitalization of public spaces, environmental agenda in public administration. And now you see some pictures as an example of which one of them. So here we have the biodiversity and greening and garden and health eating, all the actions around the city. Here we can see the actions involving the revitalization of public spaces, also activities with water, air, and soil, all over all São Paulo. And also we have here activities involving the environmental agenda in public administration and waste management. The PAVs contributes to the Climate Action Plan of São Paulo City through Action 34, which is the expansion of the program to 100% of the basic health units here of the city. The Climate Action Plan of the the City of São Paulo from 2020 to 2050, commitment to the C40 Cities Climate Leadership Group to develop it and implement an action plan that includes consistent policies aligning with the Paris Agreement. São Paulo has the Municipal Environmental Education Plan, and this document includes the short course on gardening and composting for the environmental promotion agents, known as APA, of the Department of the Environment, Environmental Education Initiative of the City Health Department, PAVs Social Environmental Diagnosis, PAVs Guiding Pillars, who carries out or who can enable environmental education in the territory. In this case, we have the units with almost 12%. Here we can see that PAVs also contributes to the Sustainable Development Goals movement. Since 2023, PAVs projects have been aligned with the relevant SDGs. Here we can see the PAVs technical group developing a brochure with the guidelines and actions on the climate change. And the program uses a territorial tool to localizate priorities actions, which is the PAV social environmental diagnosis planning, and to give priority of actions for places of risks and potentialities. The stages of the diagnosis development includes data collection, perception workshops, graphs, and the diagnosis report, which is presented to the basic health units management and health team professionals for subsequent problem prioritization and project planning. The summary of PAV's social environmental diagnoses are: 1, mapping territorial indicators; 2, enter the indicators into a spreadsheet; 3, georeferencing compliant data; 4, presenting all indicators to the team; and 5, following the presentation, defining a project theme to implement in the territory. The program coordinates various partnerships. For example, the program has a cooperation agreement with the Secretary of the Environment, through which various actions are carried out, such as courses and tree plantings. We have also partnerships with the Secretariat of Human Rights and Citizenship, Executive Secretariat of Climate Change, also known as CLIMA, partnership with the Municipal Department of Urban Planning and Licensing, also known as SEMU-GEOSAMPA. Partnerships with Municipal Department of Economic Development and Labor, Health Surveillance Department, and also partnership with the Civil Defense Department. PAVS also has partnerships with the Municipal Department of Urban Cleaning, also known as CELIM, and partnerships with the Municipal Department of Education Health in Schools program, known as PSE, and Environmental Health Education Actions in Jaraguá Village. Here we have the PAVS balances of last year. In summary, carry out almost 30,000 actions in just 1 year, 137,796 environmental home visits, reaching more than 800,000 people here in São Paulo in just 1 year. Here we have the contact information of the municipal coordinators of PAVS, Monica and Patricio, and also the website of PAVS. Everybody is very welcome to visit it. And now I'm going to show a short video about the activities of PAVS here in São Paulo.
A Prefeitura da cidade de São Paulo tem trabalhado em busca da qualidade de vida para 12 milhões de habitantes por meio de iniciativas que diminuem a emissão de gases de efeito estufa e ampliação de áreas verdes, demonstrando um compromisso sério com a sustentabilidade e preservação ambiental. Nesse sentido, a Secretaria Municipal da Saúde implementou o programa Ambientes Verdes e Saudáveis, tendo como objetivo principal a inclusão das questões ambientais nas ações de promoção de saúde. O diagnóstico socioambiental PAVS possibilita o planejamento participativo, direcionando ações e projetos para intervenções locais e intersetoriais por meio de dados coletados e georreferenciados. O PAVS conta com 333 agentes de promoção ambiental que atuam juntamente com mais de 9.000 agentes comunitários de saúde, articulando com diversos setores e atores do território. Os projetos são focados em 6 eixos temáticos que se interrelacionam pela cultura de paz: horta e alimentação saudável, revitalização de espaços públicos, biodiversidade e arborização, água, ar e solo, gerenciamento de resíduos e agenda ambiental na administração pública. Todos os projetos do PAVS estão relacionados aos Objetivos de Desenvolvimento Sustentável, incorporando o conceito de saúde única em sua interdependência e interligação em consonância com a Agenda 2030. O PAVS empodera a participação efetiva da comunidade com a construção de políticas públicas integradas para São Paulo. A Prefeitura da cidade de São Paulo tem trabalhado.
In the name of Monica and Patricio and the Municipal Health Department, I want to thank you all for the attention.
Thank you so much, Samantha. That was amazing. I felt like you took us with you to Sao Paulo to learn about the Green and Healthy Environments program, and for sharing so many important aspects of how you all conceptualized and carried out the program. And one thing that strikes me is really how innovative it is to bring these different departments together, really integrating them, as you said. That doesn't happen in so many different local governments across the world, but to really bring those different departments, those different areas together to work towards these aligned goals in sustainability, the environment, urban planning, parks, public health, among many others. So thank you so much. I also appreciated how you brought into the community. I want to thank both of our presenters for the excellent presentations. And now we actually have a good amount of time for Q&A. I believe we have pardon me, I'm just checking here the mechanism that we have, because I think we actually have the Q&A function here. And I don't see any Q&A right now. So the floor is open. Please put in your questions. But I'll start actually by asking our panelists a couple of my questions while we see what other questions the audience has, if that's all right. Okay, so this would be for both of you all. Feel free to whoever to jump in first. But, because this is part of the theme for today, I was wondering about some of the obstacles that you faced in terms of translating what Nathalie presented, this overwhelming evidence on green space and how it impacts health. How have you been able to really translate that evidence into real world, whether it's policy like Sao Paulo is able to do, interventions or projects, and how have you overcome those challenges? So either of this question could go to either of you if anyone wants to jump in. Nathalie, please, I see your hand. Great.
Thanks, Giselle. Maybe I can start. Well, yeah, absolutely. I mean, often the evidence is not enough. It's not because we have the evidence, right? And then it's easy to implement. And obviously, very often the challenges are because financially it's complicated to implement the given interventions, because it requires collaboration, across different sectors, because it's also depending on political priorities. But I would like maybe to highlight two aspects. The first one is that some of those tools that I have, and I presented the Green UR, but there are approaches, and this is just one example, but there are approaches that we should use to prioritize our actions, to make the case, and also to show that evidence is relevant at the very, very local level. So it's not general evidence, but the Green UR tool that I presented helps actually to contextualize it in a very given context. What does it mean for my population if I do change, right, the way my city is built? What does it mean for my city if we have more green spaces? So that's the first aspect I would like to mention. The second one is about the simple fact that it requires collaboration across different partners, stakeholders, and sectors. And we do forget that it's not that easy to work in an intersectoral manner, because trainings are different, knowledge is different, priorities are different, budgets are different, etc. And thus, being successful requires, though, all these different sectors to work together, but it does require to have a better understanding of how to talk to each other, how to work with each other. And in the presentation I have shown, there is one tool, again, that we developed with WHO end of last year, and that we are now rolling out and helping countries to use at the city level, which is, first of all, to identify whether capacities are actually in place at the very local level to implement a project that has a public health goal. So if you want to implement, or you want to have better green spaces, right, for health outcomes in a given city, most probably you would have different people around the table coming from different parts of the municipality. And so this tool helps actually, first of all, to understand whether the capacities within that specific team are in place to be working in an intersectoral manner, and also to build joint partnerships, etc. So maybe just to start, these are the two main points that I would like to make. Back to you.
Those are excellent points. And yes, of course, I thought of those tools, but I'm glad you were able to tell everyone here about them. so useful. But actually, Samanta, you sort of did some of this on the ground with Sao Paulo and with bringing the different municipal departments together. So do you have any insights from your experience to share?
I was just checking with the technical team here. Also, I was translating the question. And yes, we have some issues here, some challenges, I would say. The first of all is the education of the population, because here in São Paulo, as we said, 12 million of people, and everybody is living in a crazy schedule. So sometimes they put on a second hand the concern of the day-by-day environment. And so the first big issue is to put this conscience of the importance of the environment and also the relation with the health of the population. Talking about the management of the program here, the big challenge now is to get to 100% of the health units for this program. So if today we have 480 health units around São Paulo, the PAVS program is in 340. So we have more 100 units to have this program as a day-by-day activity. Also, the big challenge here is the resource. And when you say about resources, economical resource to have more investments of the program, and also human resource. So even if we have a few hundreds of employees here working with PAVS, to get to more 100 health units is necessary to have much more. And again, we are talking about 12 million people. So it's a small work day by day to get to a big goal. The expansion of the program is the big challenge here, but working integrated with all the departments. And also, as I said, I'm, for example, of the oral health department, and I learn a lot of it, and I put it on my day by day, just with the conversation with my colleagues here, I put on my day by day the activities of PAVS. So small steps, small challenges to a big goals. That's our big challenge here.
But you've made so much progress, and in such a big city with so many people. I mean, 480 health units is quite impressive. And I think, as you said, making first, the environment a priority, that's a big cultural shift. So that's a big change that you were able to make. And then to connect that with health, which of course is what I spend a lot of my time doing, and I believe Nathalie as well. So parabéns, it's amazing. It's such a great program. Another question that I had for you, I still don't see any questions in the Q&A, although maybe I missed one. Let's see. Oh, wait, we do have one. Okay, great. I had another question on equity, but let's actually go first to the question that we have here. And I think this one is for you, Nathalie, about the Green UR modeling study. So I'll just read it out for you if you're able to see, if you're not able to see it. So this is from Amy, and Amy's doing her PhD exploring green space and mental health impacts. And the question is the depression incidence in Accra. Could you clarify how depression was measured or defined in the Green UR modeling study?
Apologies, sorry, I couldn't unmute myself. So I cannot respond concretely because obviously the Green UR model has multiple elements in there that goes from, and as for mental health, it has the anxiety and depression, scale. So I cannot respond in detail. Happy though to provide obviously details of where the information can be found. And also make the link to colleagues who have been working on this tool specifically. So I don't want to say wrong things here, so I'm happy to share more information.
Great, thanks so much. So an opportunity to follow up, and I do think that tool is so interesting, and I think you've sparked the interest of everyone here. So thanks, Nathalie, for bringing it. Okay, I had another question about equity, and this also could go to either of you, but maybe I can start with you, Samanta, because equity is such a big and important issue in Sao Paulo. So one of my questions would be, how did you decide where to bring these interventions within the city, knowing that the places that are most invested in, the poorer areas, the favelas, the challenging communities in the city are lacking green space and exposure to nature the most? Did that play into your decision of where to go? Did you try to understand where some of these green space disparities were, some of these health disparities were, to decide where in the city to go? Was that something that you considered? And if you would like to translate and ask your colleagues, we will.
Yes, just a minute.
And while Samantha's doing that, Nathalie, I don't know if you have thoughts about, when you are trying to bring green, a green and health initiative to, to a project, to a policy, to a city, to a local community. How do you think about the equity issue?
Well, the equity is fundamental, right? Because, and I was starting with it when I was talking about urban health, because generally speaking, when we look at urban health outcomes, we see actually that between regions, right, the gap is actually decreasing about the inequalities. But if we look at between countries very often, but if we look within countries or within urban environments, very often we do see stark disparities, right? So in one and the same city, we will have very, very different, right, health outcomes. And the green spaces are fundamental because the green spaces, obviously the important element is that they are across the city and they are across, that you can reach them everywhere and that they are accessible everywhere. So sometimes it's not only a matter of distance, and I think this is extremely important, it's about the accessibility. You could have a very nice park in a city that you can go freely, but if you have a highway in front of it, then it's not accessible, right? Or whether the access to the park will be dangerous because of, violence. And these are equity issues. When we talk about green spaces, it's not only about the amount of green spaces, but it's about where it's located, but also how it is accessible. And then it also, how is it maintained and by whom? Because you could have, if you look, green spaces, but if it's not maintained in one part of the city or overall, right, it might actually increase, violent behavior, uncivilized behavior, and therefore all these aspects are actually crucial, right, to consider when you look at equity elements of planning.
Absolutely. And I would also add design aspects actually to that. So, we know at this point that there are ways that we can design a green space so that it's going to, decrease some of that, antisocial behavior, criminal behavior. Unfortunately, it's not always recognized, but there's that entire, canon of knowledge at this point around environmental design for crime prevention. And then there's also so much work on public space design and how we can create places that are inviting, accessible, but also safe. So there's a lot there, but as you say, it's not only what green spaces there are, although that's also important because we can also see in many places and in many neighborhoods, there's a dearth of those green spaces. That's a huge fundamental problem. And I think you mentioned also COVID during your presentation. We saw so clearly during COVID how the places that really were under-resourced and that were lacking green spaces suffered even more. But also the accessibility, how you get there, the maintenance, so excellent point. And then I would also argue the design, not all green spaces are created equal, as I say. But thank you so much. That it is a huge issue, and you've given us a lot of ideas about how to consider it. And now, Samanta, I don't know if you had some thoughts from the team.
Yes.
Considered it in Sao Paulo. Yeah.
Yes. Well, we have a big issue here with the green spaces because São Paulo is losing day by day green spaces in general. So we are a huge city developing and building big buildings and houses and etc. So we try to put this thought conscious in the population that it's important to keep the green space. And when we are talking about our department, we use the green spaces for many activities. So we have interconnection with, for example, the mental health team. So you use the green space for activities for the patients with mental health issues in the units. We also have medicine, traditional medicine, Chinese traditional medicine, and so we use the space also for the activities. We use the space for planting. So with this, we put the conscious in people for the importance of the healthy eating. And also, when you put the community to use this space, we also ask them to help it, to keep them. So it's a integration with not just the public system, but also with the population to help in this maintenance of the green spaces.
That's such a great point. And, you know, Nathalie was mentioning maintenance, and that's definitely my preferred way to ensure that we have interventions, any interventions, but especially public and green space interventions, I would say, that are community driven from the beginning, that the community feels invested in them, and they really will contribute to the maintenance of those initiatives. It also ensures that you're actually addressing the challenges or the things that the community wants. So I think it really ensures a greater chance of success and sustainability and an ongoing investment. So thank you so much for all those insights. That's fantastic. We have another question here in the chat. This is from Anna. And they had a question about the health impacts of blue spaces as well. So we hear a lot about green spaces. We often sometimes hear about evidence around blue spaces. Maybe we'll start with Nathalie. You know, where is the evidence in terms of blue spaces as well as green spaces? Is it strong? Is it still growing? What is the importance, and how can we think about that in terms of impacting health as well?
So I think this is a very important question. It actually makes me think about something important to mention in this regard. The first one is that scientifically, there's more literature on the green spaces, right, and the evidence. But it's also an historical issue. More work has been done on the green spaces, and now more and more is being done on the blue spaces. But there is an increased, knowledge and evidence about the importance of blue spaces and health. And very often, actually, more and more, we do see green and blue spaces looked at together. However, the point that I wanted to make is that from a public health perspective, and that's where we also need to always look at the risks and the benefits, right? And I'm using the blue spaces just as one example. And it shows how actually complex it is when we look at urban health. Blue spaces, one of the issues from a public health perspective is that it was looked at from injury risks, from a drowning risk, right? And therefore, obviously, you can promote blue spaces for health, provided, right, that they are safe for the populations. So I'm not saying that blue spaces overall are dangerous. I'm just saying that it's important when we look at the literature, but when we implement interventions, they do increase the availability of green spaces, blue spaces, and others, that there is a very clear understanding of what are the benefits, but also how to mitigate, right, some of the risks. And this is what makes the public health interventions, on one hand, challenging, right? But on the other hand, if I flip it around, it makes it so promising because you have, a multiple benefits, you have, so depending on how those blue spaces are shaped, right, they can have multiple benefits, but as I was saying, the risks need to be mitigated.
Yeah, it's such a good point. I was wondering if that's where you were going because, I remember being shocked in public health at some point in my career when I found out I was not aware at the time that drowning is, I believe it's indeed still the leading cause of death for children aged 1 to 4 globally, which I think a lot of people don't recognize. And, my understanding is that it has historically been a greater issue in low and middle income countries. So you really have to think about how you're designing blue spaces thoughtfully in a way that makes sense. Also, I think that leads to that, the point that we're always talking about, but that we don't always see really being carried out in practice around being aware of and understanding the cultural contexts, right? So there must be something to that if it's affecting certain populations more than others. So yeah, that's a great point. Samanta, did you think about blue spaces at all in your interventions?
Well, I was checking here with the team because yes, it is going to be the next big challenge, the development of the blue spaces projects, because here in São Paulo, we have some big rivers, but everything is polluted, so it's possible to use the water. So for now, the project of the PAVs is trying to put the conscience of people to stop the pollution of those places. and also to avoid the use, importantly. And once it's starting the project of cleaning everything, so they are going to develop a project of using those blue spaces. So it's the next big challenge of the program, is how to use the blue spaces once they will be available. We hope for the next years.
Fantastic. I love that. And I see that Eduardo has put in a link to a resource here. So I'm going to move that over sort of to the dismiss side, not because it's not important. I think it looks like a really interesting piece of research, but just because it's not an immediate question for us. So feel free to follow up in the Q&A box with that piece of research. I had another question for you all. And this is, again, sort of more of a practical question. So maybe Samanta, I'll start with you here. Although if you want to ask your colleagues, then we'll move over to Nathalie in the interim. But this is a question around giving advice to, let's say, city leaders in other cities around the world that want to prioritize health through nature, green space interventions, nature exposure, accessibility, et cetera. Do you have any insights about what you would tell other city leaders if they want to replicate what you've done in Sao Paulo, if they want to really take the evidence that Nathalie's presented and put it into practice? What would you tell people?
I will take this opportunity for Nathalie while I talk to the team here.
Okay, perfect. Nathalie, when you're working with municipal leaders, what is it that you try to help them understand to start this process, to really initiate a program initiative or intervention in this area? Do you suggest the capacity building tool as a first step, or what advice would you give to city leaders who want to do this?
So I think there are two aspects of it. Obviously, the evidence is important, helping professionals at the municipal level to have an overview of, efficient interventions, etc. This being said, in an area like we are operating with, I tend not to use the approach of what we can call best buys as in other areas of public health, because in a given urban environment, there are so many factors playing with each other that it's so complicated to say these are the 5 interventions that would work. So to respond to your question, I think the biggest, there are 2 big parts of. The one is obviously being knowledgeable about the evidence, about possible interventions, but the second most important is the process. So it's advising about how, at the municipal level, how a city, right, would actually set up the whole process for, identifying priority areas, identifying those best interventions that are particularly important in that given local context, how to implement it, how to monitor, etc. So yes, the capacity building, the assessment is an important one, but it's also about community engagement processes, right, to make sure that the interventions that are identified are also actually meaningful, right, for the populations. So it's about the process. It's a process that is based on mapping the stakeholders, maybe mapping the needs, right, engaging the different sectors, strengthening their capacities, and then all this will actually be helpful for then implement a given intervention. And maybe to conclude, very often, and WHO has a number of city networks that either we are leading or co-leading, and the objective of those networks is actually to provide them obviously with resources, but also most importantly, to give them a room, a platform to exchange experiences, right? And so, and those experiences very often, it's not only a one-to-one sharing. It's not saying, okay, look, I did this, and then the next city will say, okay, I will do the same. No, it's by trying to understand, based on multitude of experiences, what would be the best one for the given local context? Because the given local context, as you were saying, Giselle, is very important, right? So there is global knowledge, but then this needs to be applied in a very local, in local circumstances.
Absolutely. That's really a great way to think about it. Samanta, over to you. If you had the opportunity to tell other city leaders how they could do something similar, but being, of course, recognizing the specific context that they're working in, what would you tell them?
Well, the same of Dr. Nathalie, who was brilliant on her speech. Here we would use the same tool. So first of all, the diagnosis is the priority. So you have to identify what are the problems, where are the problems, and then depends on the condition of each place. Because, for example, here when we talk about Brazil, we have a city as São Paulo that loads of resources, but comparing to the cities of the countryside or in the north, we may not have the same resource. So first of all, you have to identify what are your resources and how you can implement more resource with your tools. And then you have to train people to put in their conscious the importance of the environment and the relation of the environment with the health. And it's an exercise of day by day. And then when you, with them, everybody together, the health professionals, the management team, and the community, everybody develop a plan. You have to implement the plan, and also you have to follow if it's having results. So it's important in our vision here as a management team to follow, because sometimes you have a plan for one place, but cannot be the same plan for other one, because you have to consider all those factors. And once you have success on this, it's important to share also these rules that, as Dr. Nathalie said, with other places, because sometimes people just need an idea. So I can listen to this idea. Oh, they tried this and they got good results. Maybe you could try also this here, but maybe we have to adjust with our reality. So we think that's the most important. Identify the risk, try to find what are your resource, economic and human, put the conscience and everybody together to work as a team, try to implement that plan, follow up the results, share the results, and adjust something if it's necessary.
Thank you so much. That's really great insight. And I think very helpfully, I noticed that you put the contact information of your team members also in your presentation. So I'm sure people can reach out. But I also really like your addition of the asset mapping piece. So that's a really important piece that we always want to do. We don't always want to start from the needs, but also want to understand the assets and the resources that we already have. Well, with that, it looks like we're actually out of time already. I could have kept talking to you both for a lot longer. This was fantastic. I want to thank you both so much. Thank you, Nathalie. Muito obrigada, Samanta. I'm going to pass it back to Francesca, but really a great conversation, and thank you all for being here.
Thank you ever so much. Absolutely fascinating. I think I myself have come away with a lot of ideas and really inspirational conversation there. Thank you so much for being our MC today, Giselle, and also thank you to Nathalie and Samantha and the rest of her team for those brilliant presentations and very insightful discussion. To you, the audience from around the world, thank you for joining us, and our next briefing is looking at sustainable water management with urban planting on the 17th of June. I hope you've enjoyed today's webinar. This session has been recorded and will be available on the AIPH YouTube channel shortly, and also publicised via LinkedIn. Finally, I'd like to thank our sponsors of the briefing series, the Worshipful Company of Gardeners. Until next time, thank you all ever so much, and goodbye from me and the AIPH Green City team.